Hi, I am Angie with the League of Women Voters of Metro St. Louis. For more than a year now, our League's Healthcare Committee has been studying Medicaid expansion. We are excited to share with you what we have learned. For years, many Missourians have been seeking a solution that provides access to quality and affordable health care. Integral to that solution is Medicaid expansion. It took more than 350,000 signatures from voters across Missouri to get Medicaid expansion on the ballot. All Missouri voters have the opportunity to vote for this solution on August 4th. Voters will decide what is best for the health of Missouri's people. In support of Medicaid expansion and to search out the best solution for Missouri, the League of Women Voters studied this question: how has the experience of healthcare changed in those states that have expanded Medicaid? We looked at individuals and families, their health and finances. We looked at healthcare facilities and healthcare professionals. We looked at the Missouri state budget. We looked for the effect of Medicaid expansion on communities. We found much to support expanding Medicaid in Missouri. From our findings, the League of Women Voters supports Medicaid expansion as the practical and highly effective means for addressing poor health outcomes and marked health inequities in Missouri, and with no added cost to the state. Medicaid is the single largest source of health coverage in the U.S., covering 1 in 5 Americans. This provides well-documented health benefits for around 74 million people. Included in the Affordable Care Act that was passed in 2010, Medicaid was mandated to expand coverage to individuals with income levels below 138% of the federal poverty line. This amounts to $18,000 annual income for a single person or $23,000 per year for a couple. The ACA required states to expand Medicaid by the year 2014 for the purpose of increasing access to quality and affordable health care for persons all over the country. Also, with the ACA, 4 states that expanded Medicaid, the federal government gave a 100% match for healthcare costs through 2017, a 95% match through 2019, and a 90% match starting in 2020 and going forward. In 2012, the Supreme Court ruled on the constitutionality of the Affordable Care Act. Their only ruling was that the states could not be required to implement the expansion of Medicaid to include everyone at less than 138%. States could legislate Medicaid expansion, including certain coverage requirements. To date, 37 states and Washington, D.C. have passed legislation to expand Medicaid. Researchers from Washington University have estimated that Medicaid expansion in Missouri could have cost savings of $39 million in the first year and get more than $1 billion of our taxes back from Washington by 2026. In the researchers' analysis, they considered the number of new Medicaid recipients and those who are already Medicaid recipients, as well as various federal and state requirements. By not expanding Medicaid since 2014, Missouri has turned back over $15.5 billion to Washington. These dollars are lost to Missouri. By not expanding Medicaid for years, those federal dollars went to other states who have expanded Medicaid. Currently in Missouri, the federal government pays 0 to 65% for Medicaid eligible persons. With Medicaid expansion, the federal government will pay 90% of the care expenses for people on Medicaid. With Medicaid expansion, there will be additional revenue due to greater economic activity because of the increased employment. And also, when you expand Medicaid, it will bring more efficient provision of services and administrative practices. Today, Missouri Medicaid covers only disabled people, pregnant women, parents with children under 6, and some seniors. Low-income people without Medicaid are unable to afford private insurance on the marketplace. Low-income individuals and families have to balance healthcare costs with other necessities such as housing, food, and transportation. Given the choice between paying for health insurance or for food and a roof over your head, a person is probably going to take their chances on needing health insurance and choose the immediate need for food and shelter. Medicaid plays an important role in rural areas. Medicaid provides the insurance companies to help insurance coverage to help reduce the number of people who would have no coverage at all in rural areas. A few notes about non-elderly adults living in rural areas. They are significantly more likely to have a disability, to be unemployed, and be poor. These low-income, non-elderly rural adults have significant barriers to getting health care, such as provider shortages, recent closures of rural hospitals, and having to travel a long distance to providers. Medicaid provides timely and affordable access to health care in times of catastrophic events. That health care access is critical to the well-being of individuals, families, and communities when emergencies hit. We are currently experiencing a health crisis in this country, and having health care is an urgent need. Those who have had health care coverage through their jobs are losing those jobs, and then their insurance coverage disappears. Expanded Medicaid would provide crucial care in times of serious need. So what is the goal of Medicaid expansion? To bring access to health care and greater economic security to low-income households by making health care affordable, by reducing financial strain, and by protecting against catastrophic medical costs and medical debt. Having a source to help pay healthcare expenses is needed to maintain a healthy and productive life. The August ballot is every voter's opportunity to make a difference in the health of low-income Missourians. Look at the improvement in healthcare for individuals and families when Medicaid is expanded. More than 230,000 people that currently do not have access to care will be able to get care. Access to Medicaid insurance allows people to have a regular personal physician to follow their illness or condition. Plus, people will be able to have preventative care. This can help them from getting an illness or moderate the progression of an existing condition. Having a regular personal physician is considered essential to maintain your health. Look at the improvement for women and infants when Medicaid is expanded. Decreased infant and maternal mortality rates. When you look specifically at African American infant mortality, Medicaid expansion has lowered infant mortality by 14.5%, whereas in non-expansion states, the decline was much less. With Medicaid expansion, maternal deaths are lower too. Here are some important financial outcomes for families and individuals when you expand Medicaid. In Missouri, 53% of low-income, uninsured adults reported problems paying their medical bills. But for families who gained coverage under the Medicaid expansion in other states, paying medical bills was not as hard. With Medicaid expansion, people can choose to have a medical procedure rather than postponing care due to costs. Whereas uninsured adults are likely to report that these medical bills would use up their savings or lead to difficulty paying for basic necessities. Also, Medicaid expansion reduces the number of bankruptcy filings. In Missouri, the majority, that's 65% of Missouri's low-income, uninsured people report that cost is the greatest barrier to obtaining insurance. Just look at the impact on jobs and communities when you expand Medicaid. Medicaid expansion helps maintain a skilled workforce. In one report, nearly 70% of people said that getting health insurance helped them do a better job at work. Medicaid expansion also reduces uncompensated care costs. In expansion states, uncompensated health costs were reduced by nearly $6.2 billion. With Medicaid expansion, communities see a reduction of hospital closures. One study found that hospitals were 6 times less likely to close in expansion states. 72% of all rural hospital closings are in states that have not expanded Medicaid. Did you know that 45% of Missouri's hospitals are located in rural areas, and 10 hospitals in Missouri have closed already? Medicaid expansion will generate nearly $2 million a year in economic activity. Without Medicaid expansion, the hospital emergency department is a major source of care, which is most expensive and least effective in preventative care and long-term treatment. Let's look closer at how Missouri saves when Medicaid is expanded. When we moved the federal state match rate to 90-10 from 63-0, Missouri will save money. For example, today, pregnant women and persons with disabilities get a federal reimbursement of only 63%. It will go to 90%. Another example, today, people who are blind or who are incarcerated get 0% federal reimbursement. This will go to 90%. In addition, more healthcare jobs will boost state revenue. And when over $2 billion in federal funds are pumped into the state's healthcare system, it grows state revenue. With Medicaid expansion, there will be better coordination and efficiency in the care provided. It is more efficient to keep healthcare closer to patients in rural areas, and Medicaid expansion will help keep rural hospitals open. In addition to providing healthcare, these funds would boost the local economy and protect the jobs of frontline healthcare workers. During this pandemic time, these healthcare jobs are so necessary. Now, here is proof that expanding Medicaid has saved other states and grown their state revenue. The Affordable Care Act is in its 5th year of full expansion. So now we have a track record of actual costs in those expanded states. Here are examples of additional revenues to state budgets. In Louisiana, $199 million was saved in 2017 from multiple factors, including the federal match rate and overall state and local tax receipts. In Virginia, an estimated $421 million in state budget savings were allocated to other budget priorities, such as education. In Montana, state costs for expansion were offset by savings that expansion created, and there was new revenue resulting from increased economic activity. Colorado saw increased income, sales, and use taxes resulting from expansion, which totaled more than $100 million in 2016 and will exceed $150 million by the year 2025. So far, objective evidence indicates that actual costs are minor when states expand Medicaid. Also, states across the political spectrum do not regret their decisions to expand Medicaid. Now that Medicaid has been implemented for years in many states, there is credible evidence to show that claims of very high costs for Medicaid expansion are overstated, misleading, and substantially inaccurate. Also, note, our neighbor states, Arkansas and Kentucky, implemented Medicaid expansion and have seen improvements. Michigan is another Middle America state that implemented Medicaid expansion and saw improvements. Nebraska and Oklahoma have passed Medicaid expansion legislation and are working on implementation. On your August ballot, you will see Amendment 2, which will expand Medicaid in Missouri if passed. Here is the ballot language. Do you want to amend the Missouri Constitution to adopt Medicaid expansion for persons 19 to 64 years old with an income level at or below 133% of the federal poverty level as set forth in the Affordable Care Act? Prohibit placing greater or additional burdens on eligibility or enrollment standards, methodologies, or practices on persons covered under Medicaid expansion than on any other population eligible for Medicaid, and requires state agencies to take all actions necessary to maximize federal financial participation in funding medical assistance under Medicaid expansion. State government entities are estimated to have one-time costs of approximately $6.4 million and an unknown annual net fiscal impact by 2026 ranging from increased costs of at least $200 million to a savings of $1 billion. Local governments expect costs to decrease by an unknown amount. In August, your yes vote on Amendment 2 will bring Medicaid expansion to Missouri. This is a list of just some of the organizations that support Medicaid expansion. You see here the Missouri Chamber of Commerce, the AARP, Missouri Rural Health Association, organizations for doctors, nurses, ambulance districts, and firefighters, associations that serve those suffering from many health conditions support Medicaid expansion. On this list, there are community groups and religious organizations. Medicaid expansion makes sense for Missouri. Help spread the word where you can. Remember that your yes vote on Amendment 2 will bring Medicaid expansion to Missouri. And then make sure to vote on August the 4th. Thank you.